I think when you think of swing bed integration, you think about quality care at home. And when we have patients that are coming from all over our service areas to be able to come back for the post-acute care services they need within their own community hospital setting, it increases quality, it increases access, but more importantly, it increases patient outcomes because your providers know you. You're receiving care at your local hospital, and that's what's the difference between us and other skilled nursing facilities and swing bed facilities across the area. I look at it as a holistic aspect. It's how do we here at Central Maine Healthcare provide care for the full continuum. So a lot of times we refer to the care received here at Central Maine Healthcare or Central Maine Medical Center, but we're really talking about the care that's evolved throughout our system. So these folks will transition from here, our main hospital campuses, to Bridgeton and Rumford to really get that specialized level of care and service and therapy that they can't get here at our local hospital.
Swing bed program is exactly that. We're swinging you from the acute phase of your illness in the hospital to home. And swing bed is that term, and it's used nationwide for critical access hospitals as that program for rehab services. And the goal is always to get the patient back to their pre-hospital admission state so that they can be home with their family.
The goals are set when the patient comes in, and once the goals are met, they will be discharged. But a typical swing bed stay is 7 to 14 days. If a person is in the swing bed program, because we are a hospital, it makes it easier if a patient does become acutely ill. They don't have to go through that process of being transported from the other facility to an emergency room. We can take care of everything right here while they're in the hospital. We can transition them to an inpatient status. Or if they need a higher level of care, we can make that happen as well.
The case manager is somebody who helps facilitate the progress through the swing bed program. I'll meet with you within a day or two of your arrival here. I'll do a complete baseline assessment, basically where you live, if you live in a house, trailer, apartment, what type of medical equipment or services you already have at home, how much of your activities of daily life you did by yourself, and how much assistance you got. We'll use this information throughout the swing bed program to make sure that we get you back to what is called your baseline, what you were able to physically do before you came to swing bed.
So the swing bed program here at Rumford Hospital is a really unique way that our patients can get their rehab care closer to home. There's a lot of patients that could benefit from the swing bed program. Some of the obvious patients would be if you've had a procedure like an orthopedic procedure, maybe hip fracture. Sometimes there's cardiac procedures like a bypass. Or even something more significant like organ transplant. Those patients a lot of times are weak, not as strong as they used to be, so they could benefit from getting some extra therapy, and that's part of what we do here. There's also other patients too, patients with complicated wounds that may need more closer medical management. They might need wound care specialists, certain types of dressings or medications, and those are patients that we take care of here too. You basically have all of the services that are at the hospital available. So that would include the medical team, the physicians. It would also include, of course, our excellent nursing staff, as well as a whole variety of our therapies, physical therapy, occupational therapy, speech therapy, and nutrition. Also, we have the benefit too, if anything comes up or if part of the patient's medical problems maybe means they need follow-up imaging, we have x-ray available, all of our imaging services. Labs, medications, anything you can get at the hospital pretty much is available to our patients here.
People present to our swing bed program with various nutritional needs, so I get the opportunity to meet with them one-on-one in order to optimize their nutrition while they're here so that they're better able to work with therapies and meet their goals. Typically, we think of proper nutrition is only important when we're managing or preventing chronic illness, but following an acute illness or an injury, it's important for the recovery process. And also to meet their goals, whether it's physical therapy or occupational therapy.
The speech therapy services I provide to swing bed patients deal with swallowing issues and speech and language changes. First and foremost, I would make sure that a patient was able to swallow okay, was on the appropriate diet. If there were some swallowing issues, we have options. I would do a bedside swallow eval initially. We do have video swallow services that we do here in conjunction with x-ray so that we can get a closer look at what's going on. And then therapeutically, I have things to offer such as exercises, swallowing strategies, maneuvers, and I have a special certification in neuromuscular electrical stimulation. Speech and language, it would depend upon whether the patient was having trouble speaking, word finding, or if there were some cognitive changes. It's a very individualized program.
Physical therapy is a great big part of the swing bed program. We actually provide a full evaluation on all of our patients when they enter swing bed, and we evaluate their functional mobility, their balance, endurance, their strength, and we'll come up with goals based on the patient goals, family goals, and individualize a treatment plan based on that. We will provide gait training for them if they need that. We'll provide balance training, strength training, endurance training. We do a lot of teaching with the family and also with the patients as well, just on their diagnosis, on home exercise programs for them, and so forth. We also do a lot of equipment, so we can provide walkers, canes, crutches, all of those items, even wheelchairs. We even do braces as well if patients need them. So it's just individualized based on what the patients need.
Occupational therapists work with our swing bed patients to help them to get back to doing the activities that they have to do every day. In and out of bed, in and out of the bathroom, getting dressed, putting on their socks and shoes. Sometimes they're able to do it alone with some help or with adaptive equipment. And if patients can do it with adaptive equipment and are still independent, then we call it good that they're independent. So we work on getting them back to doing what they need to do. Sometimes folks have to go home with some help, and their families will need some training as well. And while the person is here in a swing bed stay, we offer a family care day, a 24-hour family training, so that family members will actually know what the patient needs for 24 hours. So they come here and they stay here and they work with us. That's how we get people from admission to discharge, one day at a time.
Swing bed patients are a little different, I think, than the average patient. So the services that respiratory therapy provides to the swing bed patient here at Rumford Hospital is, to a large extent, to me, it's an educational thing. And that kind of goes back to the heart of what respiratory therapy does. We try to teach and educate. We're there for the patient where, should something acute occur, certainly, but the big thing is to try to help them to best utilize what lung function they do have, assuming that they do have some sort of a problem, some sort of a compromise with their lung function, whatever it is, to try to let them best utilize that when they get home, because in essence, swing bed is all about getting people to go home.
There's a little cliche about everyone knowing your name, and that's exactly what it is at those settings in Bristol and Rumford. Is you just aren't a patient, you're just not a number, you're someone with a name, with a family that's there to support you for the long haul. And those community hospital settings with their swing bed programs just do that. And I think that's probably why we're able to achieve the optimal outcomes that we can in those settings, because you're more than just a patient, you're part of our Central Maine healthcare family.